Hi guys, Alexia's so awesome. So I'm fulfilling requests this week. So if you comment under my video and you ask a question, I'm going to answer them. So I had somebody ask me about the 𝗖𝗵𝗶𝗲. What is it like? For me, the 𝗖𝗵𝗶𝗲 is the bestest because as I mentioned before, I started out in a facility where they had all ICUs: CV, vascular, MICU, SICU, neuro. So I started out in a place that had all those things. When I got to that hospital, they had recently lost their open heart program. So I didn't get a lot of cardiovascular experience. So for me, CV is everything. And I'm learning a lot because I didn't get a lot of it when I was an undergrad, when I was fresh out of school. So for me, it's kind of like you kind of have to, if you're interested in 𝗖𝗵𝗶𝗲, I'm going to tell you to know the cardiovascular system well. And I'm also going to tell you that the drugs and stuff that they use, like the drips and the stuff that they give the patient, are very unique. And they all serve a different purpose, like inotropes and stuff like that. The medications they give when they're trying to increase blood pressure, or, like if the patient is looking sepsis-y and has low blood pressure and stuff like that, the medications they give for that. Or if you have an open heart that is getting bradycardic, the medications they give for that. Or if you have an open heart that goes into AFib, the medications they give for that, or sinus tach, and like the protocols and stuff like that. So I consider like the 𝗖𝗵𝗶𝗲 nurses triple badasses because they're very well equipped and very knowledgeable when it comes to those things, because that's all they do, right? All they do is work on a cardiovascular system. Initially, when I first got out of nursing school, I thought that's what I wanted to do. When I did my last rotation as a nurse, I did ICU, and I specifically did like the SICU, and the SICU just took my heart. The traumas just took my heart. So I didn't get a lot of 𝗖𝗵𝗶𝗲 experience. So I'm kind of like getting a feel for that now. I don't know how long my contract will be in 𝗖𝗵𝗶𝗲. They kind of have me there to fill a need until they get adequate staffing. But as long as they allow me to, at least to the end of the year, I'm hoping to stay on contract there and just learn as much as I can. 𝗖𝗵𝗶𝗲, they're very big on like getting the patients up and out of bed post-op, sitting them in the chair. PT/OT is a big deal because they want to get them back and as functional as they were before. So they're very big on that. Get your patient out of bed once you get them stable. Some of them comes with big sheaths and stuff, right? Because they do a lot of like incisions in the groin and in the neck. And a lot of them come with like arterial lines. So if 𝗖𝗵𝗶𝗲 is something that you're thinking of, I would definitely study those things, right? They want to know like the pressures. What am I thinking of? Arterial pressures. They also want to know like the CVP, the central venous pressure. A lot of them sometimes come out with maybe like kidney issues, so they might have to go on like CRRT, right? Which is like ICU. They do like dialysis that is performed by the ICU nurse. It's a good skill to have. So there are a lot of things and skills that you can learn in 𝗖𝗵𝗶𝗲. I feel like for me it was a gap, like I mentioned before, because I had to go back over and reread about my drips and stuff like that, and what I'm supposed to use in this situation. My patient's bradycardic. What do I give? A lot of the medications, when you run codes and stuff like that, or if you have a hypotensive patient, or if you have a septic patient, a lot of the medications are similar that you give. But in the cardiovascular patient, because they've had like cardiovascular surgery and stuff like that, it's just different how they give them and how they do it. So 𝗖𝗵𝗶𝗲 to me is bomb. I love it. I love it. I love it a lot. My background is basically SICU and neuro ICU. That's where I spent the majority of my time undergrad. So I'm loving 𝗖𝗵𝗶𝗲. The nurses where I work at are very well versed and very, 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 very good and very educated. So when I have questions, I just ask. Like, all of them know my background. I've been doing ICU 7 years. All of them know that I'm a nurse practitioner. So I'm always like, I'm a nurse practitioner, but I do trauma. So like, educate me as much as I can on 𝗖𝗵𝗶𝗲, because the more I learn there, the better I can be of assistance to my trauma patients, because I'm more equipped with knowledge. So yes, 𝗖𝗵𝗶𝗲 is bomb. If you're thinking about it, definitely look into it. Do some research. If you have any other questions or concerns, I'm here for you. Alexia's so awesome.